Hello, I'm Dr. Marla Shapiro. I'm a professor in the Department of Family and Community Medicine at the University of Toronto, and I sit on the Board of Trustees of the North American Menopause Society. I'm pleased to have Dr. Lisa Larkin joining me today. She's an internist as well as president of Lisa Larkin, MD and Associates, and director of Women's Corporate Health at Tri-Health in Cincinnati, Ohio. So if I'm a midlife woman, one of the things that I forget about is immunization. I may see on TV an ad about if I'm traveling and get a hepatitis shot, but are there any other routine shots that I should be getting at this stage in my life?
So absolutely. So one of the things I would say is that immunizations are critically important to the health and wellness of all adults, but especially midlife women is an area where we know we're under vaccinating.
We focus on kids, right? But we are grandchildren, our daughters, our sons, but we don't focus on us.
Right, and certainly in today's healthcare environment, vaccination, which is disease prevention, is often missed. Midlife women are often showing up in their primary care provider's office for a specific illness or to manage a disease. And so immunizations are not always on their radar or the clinician's radar, and they often get missed.
So let's first talk about seasonal vaccinations, something that I probably should do every year.
Right, so every year everyone should be immunized for a flu vaccination. So typically we recommend immunization in September or October, but certainly anytime during flu season, if an adult has not had their flu vaccine, they should be immunized.
Okay, so what about pneumonia vaccines?
Right, so pneumonia vaccine is something that's become recently a little more complicated in the sense that now that there's two different pneumococcal vaccines. So many patients think that they've already been immunized for pneumococcal vaccine, but they need to really remember now that there's two different ones, and they should bring this up with their physician.
Okay, what about shingles? I see lots of ads for shingles.
So shingles is another one that I typically see gets missed. All adults over the age of 60 should have the shingles vaccine, and those are adults even if they've had prior shingles.
Are there some people who can't take the shingles because it's a live virus?
Right, it's a live vaccine. So patients that are immunocompromised, so HIV infection or patients on chronic steroids really should not receive the shingles vaccine, but everybody else should.
Okay. I guess another one that I think about is just my routine tetanus.
Right, so tetanus also is something that gets missed for adults. Again, it's something that's kind of off your radar. We think of tetanus as something that you get after you've had an injury and a laceration. Tetanus in adults is really important because of the need to re-immunize adults for whooping cough. So we know that whooping cough immunity wanes as adults age, and certainly adults who have new grandchildren about to be born, they really need to have their whooping cough booster. So it's a tetanus with whooping cough.
So I guess the other thing and the message that I'm getting is that I, as a patient, should be proactive with my healthcare practitioner about asking.
Right. Again, I think that, and as an internist, I'm very sensitive to the way that the practice of medicine is now. It's just very difficult to do everything on every visit. And so having an engaged, educated patient who can remind me to talk about vaccines when I'm seeing them in the office is very helpful. So again, if your physician isn't asking you about your vaccines, I suggest that patients bring it up with their provider.
And given the fact that we all tend to forget lots of things as we get older, I guess having a record would be critical.
Right, absolutely. And I think electronic health records make kind of tracking of vaccines for both patients and clinicians a little bit easier now, but it's always good to have your own list at home.
Thank you so much.
Thank you.